HighBridge, a division of Recorded Books, presents Pregnant While Black, Advancing Justice for Maternal Health in America by Monique Rainford, MD, read by Monique Rainford, MD. Prelude. She was about 18 years old and pregnant with her first child. She was an African-American female. She was overweight. Technically, she would be called obese. She came in because at almost 9 months of pregnancy, she was not feeling her baby move. She was admitted and placed on the fetal monitor. The nurse was unable to find fetal heart tones, and an ultrasound confirmed that the baby was dead. I had never met her before that night. I broke the news to her and her boyfriend, possibly the same age as her. We started the process of inducing labor. A few hours later, I got a frantic call from one of the nurses. I rushed back to the patient's bedside. My patient was not breathing. We called a code and got all the support we could, but it was already too late. She was dead, and I knew that at least that day there was nothing we could have done to save her life. She likely had an amniotic fluid embolus, a rare pregnancy complication that at that time was thought to be fatal more than 80% of the time. I had to tell that young African-American man, still a boy perhaps, that he not only lost the baby that he was looking forward to fathering, but one of the loves of his short life. Now, almost 2 decades later, I wonder if the healthcare system could have saved her. Not that night, because I know there was nothing else we could have done. But could we have done more to prevent the events that led to the death of her baby and increased her own risk, which ultimately led to her death? What could we as physicians have done? What could we in healthcare have done? Introduction. Black women in America are 3 times more likely to die from pregnancy than if they are described as white. Race as a risk factor has nothing to do with a woman's genetic code, and too much to do with the social systems in America, systems that have been in place for decades and that are not being dismantled quickly enough. Structural racism, the system and policies which reinforce racial inequities, increase a Black woman's likelihood of having more life-threatening complications, but also increase her likelihood of receiving suboptimal care for these complications. Racism in its many forms makes it more dangerous for a Black woman to have her baby in the United States of America, where her risk of dying from pregnancy-related complications during pregnancy or during the first 42 days after pregnancy was more than 40 in 100,000 even before the COVID-19 pandemic. By comparison, during that period, the risk for a Mexican woman having her baby in Mexico was 33 in 100,000 and 25 in 100,000 for a Grenadian woman having her baby in the small Caribbean island of Grenada. Black mothers across socioeconomic classes are needlessly dying. And as a practicing Black obstetrician and gynecologist, I have learned that education and class do not protect us, nor do they lessen our maternal death rate. Is this a new problem? The answer is no. But what is new is that within the past 7 years, this issue has made it to mainstream media due to the work of several investigative journalists, including the groundbreaking work of Nina Martin, who tracked and identified 134 of the 700 to 900 women who died from pregnancy-related causes in 2016. and published some of their heart-wrenching stories in ProPublica and on NPR, as well as the continuing outstanding and impactful work of Linda Villarosa, who spent decades exposing the health inequities that affect Black people in America. Another reason is the selfless advocacy work of the women's families, including Charles Johnson, the son of the TV judge Glenda Hatchett, who lost his wife Kira Johnson, and Wanda Irving, who lost her daughter Shalon Irving, both due to circumstances that leave many pained and bewildered. Both women were successful, highly educated Black women. In addition, advocates such as Dr. Joya Crear Perry, the founder and president of the National Birth Equity Collaborative, have used the fuel of their own difficult birth experiences to advocate for change. And celebrities, including Serena Williams and Beyoncé Knowles Carter, have been talking about their near-death delivery experiences. Finally, a tragedy is being recognized for what it is, not a Black tragedy, but an American tragedy, and is receiving well overdue attention. It was at Harvard Medical School that I first noticed that these disparities existed. I remember sitting in a class in the amphitheater of the conference center, now known as the Joseph B. Martin Conference Center, reading what I considered a startling statistic presented on a slide. The infant mortality rate for Black American babies was worse than that of Jamaican babies and more than double the rate of their white counterparts. I could have easily missed it. It was one of many numbers on a busy slide. However, that statistic, which I still remember some 30 years later, had a significant impact on me. While, on the one hand, I was pleased that Jamaica had relatively good statistics for a developing country, I could not understand how this first world country, with all its modern facilities, could have such trouble caring for its citizens. If there was a substantive discussion about it at the time, I certainly do not recall. I suspect there was not. Over the years, I often heard the same answers. Disparity was the result of socioeconomic factors. It was not until many years later that I learned that the disparity in health between Black women and white women remains even when socioeconomic factors are accounted for. Poverty could never have told the entire story because poverty was definitely a factor in Jamaica too. I heard other explanations which were unsatisfactory. However, being swept up in the demands of medical school and residency, I left it there. Years later, after I returned to Jamaica and set up a gynecology and obstetrics practice and came back to live in the United States in 2014, I would come to a better understanding of the real factors that contributed to the disparities, racism in its many forms and its consequences. I listened to 2 TED Talks which discussed the effect of racism on the health of African Americans. The first was by Miriam Zoila Perez, where she talked about the JJ Way, a model of delivering prenatal care established by Jenny Joseph, a British-trained midwife. Then, Dr. David Williams discussed how racism was making Black men in America sick. It was an aha moment for me because finally there was another piece of the puzzle, perhaps the most important piece. It was not necessarily about direct acts of racism, but sometimes subtle, unconscious, or implicit bias, such as not giving the patient as much medical attention as she deserves due to her race, frankly, giving her substandard care, or making race-based assumptions about her. It's about social structures that have been in place for years that continue to discriminate against African Americans. It was the way an African American pregnant woman might be treated on a day-to-day basis. Unfortunately, I have observed this implicit bias in professional settings throughout my career. But having been raised in Jamaica, I did not always recognize it for what it was at the time. It was a feeling that something was not quite right, but I did not yet have the words or the knowledge to understand what was wrong. Trying to understand the idea of structural racism and implicit bias and its impact on the care Black women received meant looking back at my own experience as a Black woman in America. I was born in Brooklyn, New York, to Jamaican immigrants. Facing the racism that still existed in New York at the time of my birth in the 1970s, my father wanted a better life for his family. He was certain that remaining in America at that time would have thwarted his professional growth and stifled the opportunities he was able to provide for his family. My mother, having just completed a Master's of Arts Nutrition from New York University within 6 months of my birth, was open to the possibilities, including her husband's desire to return to their homeland. So it was that my 2-year-old brother and I, an 11-month-old baby, flew home to Jamaica with my parents. My pride and keen awareness of my dual citizenship was manifested in different ways. In my elementary school career, I promptly stood up in my 2nd grade class when my teacher asked if there was anyone from another country in the class. My off-key belting of the Star-Spangled Banner, an attempt to play it on the piano in the living room of my house in Kingston, Jamaica, and the certainty I had at age 10 that I was not only going to pursue tertiary education in the United States, but I would be attending Harvard. I thrived in Jamaica. I was at the top of my class from kindergarten B to 4th grade. At the end of grade 4, I took and passed a special entrance exam and earned a 7th grade place in one of Jamaica's top high school for girls, Immaculate Conception High. The fact that the transition was easy speaks of the excellent preparation I had in elementary school. At the end of my first year, at the age of 11, I proudly walked on the stage at the year-end prize-giving ceremony multiple times, having achieved first place in multiple subjects in the entire 7th grade of more than 200 students. However, to say I was an all-rounder at the time would be a stretch. I was a subpar athlete at best, was informed by my always loving but equally blunt mother at age 7 that I could not sing, hence my decision to abandon my career goal as a singer, and was decidedly socially awkward. I may have won awards as a scholarly nerd, but would not have made the cool girls list. My initial decision to become a doctor occurred at the age of 7. My chin split open when my brother and I were jumping from the bed, an activity we both knew we should never do. I was carefully bandaged, but my caregiver at the time opted not to disturb my parents at work. Hours later, when they arrived, they were shocked to find the state of their only girl. We immediately went to Oxford Medical Center, what would have been the equivalent of an urgent care at that time. I was carefully sutured by the physician working that evening. He was a kind, compassionate, slightly overweight, dark-skinned gentleman of medium height. He rewarded me for my bravery with a 50-cent coin. He became a hero in my 7-year-old's eyes, and I immediately knew I wanted to be like him when I grew up. High school at Immaculate was intellectually exciting. I was exposed to a variety of subject areas, including some of my favorites in the earlier years: Latin, history, chemistry, and Spanish. Maybe I could be a translator or a lawyer, I thought. Then tragedy struck. Word reached my parents that my elementary school principal was in the hospital. I loved Sister Pat. I remember her attentively listening to me sing and deciding to allow me a place in the choir, a position I realized later was largely based on my strong enthusiasm to sing rather than my raw talent. I remember her choosing me and a fellow classmate to represent Mary and Joseph for school assembly, but quickly realizing that it was overwhelming for the somewhat shy first grader who had a secret crush on the would-be Joseph. My parents took me to the hospital and I went into her room. She was lying in bed in a cotton nightgown, her flowing hair no longer covered by her veil. Always being a thin woman, she appeared slight as her freckled olive-brown face rested on her pillow. Her attentive administrative assistant was by her side. Sister Pat shared with my 13-year-old self her heartfelt desire. I wish I had more time. At barely 40 years old, her time on this earth was about to be over. My calling to be a doctor was cemented, but my role was less clear. I thought I wanted to be a pediatrician who also worked on finding the cure for cancer. 4 years later, despite my father's reluctance to let his baby girl go, I embarked on the plane to America with my parents to take up my freshman position at the University of Pennsylvania. I thought I knew a lot about America. After all, I had spent several enjoyable and exciting summers with my cousins in New York. I knew you could get whatever you wanted at the stores. I felt I had arrived when, as a teenager, I had a temp job in the city and took the subway with busy New York professionals to Chinatown, picked up my delicious bagel with cream cheese at the food truck, and joined the rat race at my job. I watched almost exclusively American TV, which was readily available in Jamaica, and was certain I wanted to be one of the cool sorority girls I'd watched in all those movies. However, when I arrived at the University of Pennsylvania, I saw something different. While the distinction of what it meant to be white or black in America did not occur to me as I watched TV, it was very real to me after a short stay at the university. Perhaps the reality was that growing up in Jamaica, I did not see being black as being different. I was not a minority in Jamaica, a majority black country. I was never asked to check a category marked black. There was no negative racial connotations associated with who I was. I was a child with privilege, 2 professional parents, a father who often talked of his humble beginnings. My father, one of 9 children, grew up with his widowed mother and shoeless, attending school in his early days in a hilly, rural community in St. Catherine, Jamaica, and worked his way up to owning a large 5-bedroom house on the slopes of one of Jamaica's most sought-after neighborhoods. It did not fully occur to me that all the sorority girls I identified with and wanted to emulate were white. And apart from the late, great Whitney Houston, there were very few, if any, black girls or women on American TV in the 1980s whom I felt I wanted to emulate. Furthermore, I now realize that I, too, was subject to the brainwashing by American media at the time to believe that there was something inherently wrong with African Americans, but that this certainly did not include my singing idols like Whitney Houston or Prince. At Penn, I quickly became aware of the distinct color lines dividing an American university, where people of largely the same race sat together. In the cafeteria, there was the black table, the white table, the Asian table. I sought desperately to reject the notion and to find where I fit in. but it was difficult. I was Black, but not African American, and as such, while I participated in a number of activities during my undergrad years, including multiple step shows from the proud Black fraternities and a fantastic fashion show where proudly modeled African garments with a handsome African American upperclassman, I knew I did not fit in. I spent time in the Caribbean community, and though meaningful, it was too small to sustain my sense of belonging. It was not until my second year when I felt a stronger sense that I had established a community. I decided to serve as a residential advisor in one of the less cool dorms at Penn, where I had lived my first year. My closest friends were a Japanese American who grew up in the suburbs of Philadelphia and a Caribbean American who grew up in the Bronx, New York, ironically only a few blocks from the cousins I had spent so many summers visiting. Our larger group consisted of a tall Korean American, a short, chubby Jewish American, and a slightly taller, but by no means tall, Southeast Asian American. I felt we were the misfits, the non-cool kids, but we formed a social life with one another that made college life much more enjoyable. Something else happened in those undergraduate years. I began to doubt my right or ability to be at the University of Pennsylvania because of the narrative of affirmative action that several people shared with me. Making the dean's list as a chemistry major during my first year at college did little to dispel the myth that I was not qualified to be there, but only got the place because I was Black. Having broken my leg in my second year of university and taking a physical chemistry course that I found particularly difficult, which led to a downward shift in my GPA, did little to strengthen my confidence. Even my acceptance to multiple medical schools, in addition to Harvard, the one I chose, did not strengthen my confidence. However, Harvard Medical School restored my hope in the American dream. I was pre-med from the beginning of Penn and leapt at the opportunity to graduate in 3 years and accept my place at Harvard Medical School. My childhood dreams were falling into place. After graduating from Penn, I arrived at a large, welcoming medical school environment. One of my white classmates also vocally expressed his amazement at being accepted to Harvard Medical School. However, he admitted something I would never dare to admit. His GPA was comparable to mine, and I finally realized that I had earned my place and was certainly no less qualified than any other student there. Another classmate, this time Southeast Asian, offered another welcome, which to him was a small gesture. When I shared it with him recently, he did not recall it, but to me, it was a huge thing. I was lamenting with a small group of Black students my disappointment with the seeming lack of integration in American society. They, despite having immigrant parents, had spent much of their formative years in this country, and they felt that how it is was a given at the time. However, as I walked outside Vanderbilt Hall, the Southeast Asian student asked me if I would like to join fellow classmates in a game of tag football in the quad, the open area of grass surrounded on 3 sides by imposing Harvard buildings. I remember nothing of the game because I have little interest in American football, but I never forgot the gesture. America was and remains to me the land of opportunity for people from multiple cultures, races, and ethnicities. And the best of this country to me is an environment where there is an embrace of these cultures. That is how I felt at Harvard Medical School. My participation in the Black student organization was not seen as being separate, but was embraced by the larger community, and my closest friends from medical school, in addition to strong connections with my fellow Black students, ultimately consisted of a multicultural group of individuals with Asian, Anglo, Jewish, and Latino backgrounds. I also found strong social support in the Jamaican University community in Cambridge. However, I was still scarred by the culture shock of what it felt like to be Black in America. I experienced an overt racist verbal attack early in my undergraduate years. It took me only a few months after arriving at Penn to decide that I wanted to return to Jamaica to spend the rest of my life. The planner that I was, it would have to be after I completed all my education and paid down a significant portion of my debt. One night, while returning with my friend from a party, a vehicle with 3 young white men pulled near to us. We were already on the Penn campus, only a few yards from our dorm. One young man leaned through the window and asked, "How much?" My girlfriend, a fearless Caribbean American from New York, promptly told them off. I remember one of the men saying, "The only thing good you have is the white teeth." Interestingly, although I remember it more than 30 years later, my friend has no recollection of the event. She chalks it down to having so many similar lived experiences. My desire to return to Jamaica, although partly due to the bond I had with my family, was not fueled by opportunities that existed there, but rather by the certainty that having to endure such experiences would be harmful to me psychologically. I had no idea at that time how much more harmful it could be, or was, for Black people across America. During medical school, I deviated from my almost certain plan of pursuing pediatrics. Perhaps not ironically, I shifted my path because of a powerful birthing experience. In my 3rd year of medical school, the vice chairman of obstetrics and gynecology at the Beth Israel Hospital, Dr. Henry Clapholes, allowed me to assist with a delivery. The love and tears of joy that poured out from the new parents, a French couple, are forever seared into my memory. I did not fully realize it at that time, but my fate was sealed. I would commit to a career as a physician in the field of obstetrics and gynecology and would remain committed to women's health. After completing a residency program in Washington, D.C., where I had the privilege of serving patients from all walks of life, I went on to choose jobs that initially focused on the care of the underserved, whether economically disadvantaged Black or white Americans, Latinos, other people of color, or immigrants. While the institutions I worked with ensured that people had access to health care, and while in some cases surgical services were limited, I felt that the obstetric care that we offered had all the first world advantages. I remember caring for an African American woman with HIV in the early 2000s. She did well during her first pregnancy, but had a subsequent pregnancy in short order. At a time when treatment options were far less advanced than they are today, and the patient's prognosis was grimmer, I was convinced that she would not make it, but was relieved when I saw her months later, still during her pregnancy, with improved medications that made her look healthy again. I remember having attended, during my training, to an African American woman with a serious bleeding complication due to a condition called placenta previa, in which the placenta covers the opening of the cervix at the time of childbirth. She spent several hours in the operating room, while my senior colleague and our supervising physicians tried to stop her bleeding. Her life hung in the balance. Later, when I attended to her while she was recuperating in the ICU, I was not sure she would make it because she had lost her full blood volume many times over and received in excess of 15 units of blood. But she made a full recovery. Also important, although I did not recognize how important at the time, she was cared for by a team with multiple Black doctors. In both cases, the mothers.
Sample complete. Ready to continue?